Hi, welcome back. I'm Dr. Virginia Hatch-Pigott, and this is Neurofeedback Foundations, Module 40, Testing Visual Motor Skills. The TVMS-3 is what we use in our clinic. It uses design copying to find out how well individuals can coordinate visually guided fine motor movements. Distortions and inaccuracies in copied designs help identify deficits in visual perception, motor planning, and execution. The test taker is asked to reproduce 39 increasingly complex geometric designs, each in a single attempt without sketching or tracing or even erasing. Scoring is quick and easy. Rulers and protractors are no longer needed. The record form lists common errors for each design, and the manual presents detailed scoring guidelines.
Hi, Miss Emily. Today you will be copying some shapes onto pages in a booklet. Work carefully and do your best. All you have in front of you are 2 pens. I'm going to remove the pencil. Don't make any marks in the booklet yet. Wait for my instructions before you start. First, let's practice. Look at this page. There is a design at the top, and the rest of the page is blank. Copy this design in the blank space at the bottom of the page. Do not trace over the design or sketch in it. Copy the design only once in the space at the bottom. Make your design exactly like the one on the page. Work quickly but carefully. You are not being timed. Do not erase, cross out, sketch, or draw more than one design on the page. Do you understand? Do you have any questions? Okay, now go to the next page and do that one. Okay, now go to the next page and start. When you finish that one, turn the page, do the next one, and keep on going until I tell you to stop.
Stop testing when the examinee has reached the ceiling of 4 consecutive 0 scores. That is, when you can see that the copied shape bears no resemblance to the target for 4 consecutive designs, or the examinee has not attempted the design. Before the examinee leaves the room, check to see that none of the pages have been skipped, as that will lower the raw score and will negatively impact the standard score. The TVMS-3 consists of 2 unscored practice and 39 scored designs. These designs are copied while in view in the space directly below the diagram in the test booklet. The scoring instructions are in the TVMS manual, and I encourage you to become very familiar with the manual, along with Appendix C that shows the different types of errors that patients can make. Each design receives 2 types of scores, one for accuracy and the other for any errors that were made. Look at the left-hand column. This is where you'll enter an accuracy score. This is where you start. A score of 0 is given if the design is not recognizable. A score is 0 is also given if it has been erased or redrawn, or if more than one design has been drawn in the space below the design to be copied. A score of 1 is given if there are any errors, but the design is recognizable. A score of 2 is given if the copy was correctly made or very nearly so. The idea behind the TVMS-3 scoring is not to be overly critical, but rather to note any inconsistencies or deficits that could be indicative of underlying difficulties with perception and/or motor planning and execution. After an accuracy score of 0, 1, or 2 are given in the left column for each design, you will move to recording error scores for each design in the remaining columns on the right-hand side. Enter a 1 in the appropriate column for each type of error that was made. If no errors were made, that would mean the accuracy score in this case would be a 2. Leave the error columns blank. It is feasible that any design can contain more than one type of error, so be sure to record all the errors for each design. Each type of error is explained in the manual. But to review, error 1 is closure, meaning that, for example, when you make a circle or a square or a triangle, the lines that should meet do not. There is a gap or they overlap. Error 2 are incorrect angles, meaning the arcs or angles are proportionally greater or less than shown in the target design. Error 3 is a line quality error. The line has been sketched or is very wavy or shaky or tremulous or has gaps within the line. Error 4 is a line length error. Line lengths are projected lines or dots or circles are not correct or proportional to those shown in the target. Error 5 are line connections. Lines or projected lines from dots and circles do not cross or meet as they should, or they cross or meet where they should not. Error 6 is a modification of the part or the size. The whole or the part of the shape or design has been changed so that it's different from what has been shown, or part of the shape or the design is disproportionately larger or smaller than intended. Error 7 is an addition or deletion. Parts have been deleted from the design or have been added to the design. Error 8 is a rotation or reversal. All of the design has been rotated greater than 10 degrees, or part of it has been reversed or rotated. And error 9 is an overlap. 2 or more enclosed shapes that comprise the design do not meet or overlap, but should, or the shapes meet or overlap and should not. Raw scores are totaled for each column at the bottom on the right-hand side of the second page. Raw scores by themselves provide little useful information about a person's test performance, especially if one wants to compare performance to that of others who have taken the same or similar tests. For that reason, raw scores are often converted to derived or standardized test scores. Derived scores provide a common metric with which to describe one person's score relative to that of others of the same age within a normative sample. The TVMS-3 does not have subtests, so only one raw score, the total points from the accuracy column, is entered in the spaces on the record form in the left box. The tables to use to convert the raw scores to standard scores for each age are found in Appendix B in the manual. Standard scores are based on a population distribution having a mean of 100 and a standard deviation of 15. Thus, a standard score of 100 indicates performance that is at the mean for a particular age group. A standard score of 115 indicates a person's performance was one standard deviation above the age-related mean. So the person did better than 84% of the normative population. Traditionally, standard scores are reported for a span of plus or minus 3 standard deviations from the mean and do not extend below 55 or above 145. In other words, standard scores for more than 99.74% of the population fall between 55 and 145. Percentile ranks reflect one person's performance relative to the normative population and are often easier for many parents and teachers to understand than standard scores. When conferring with parents or teachers or with adult clients, it's often beneficial to describe a person's test performance in terms of percentile ranks rather than in more specific, esoteric metrics of standard scores. Because visual motor skills develop over time, it is possible to derive age equivalent scores, the mean score obtained by someone at a particular chronological age. This type of score is least robust statistically due to the fact that it's derived from midpoint scores of ages and needs to be interpreted very carefully. Most importantly, it's very good to remember that any test result, not just on the TVMS, results from a snapshot of a person's performance at one particular point in time and on one particular set of tasks. It does not tell the whole story of why that person performed the way he or she did. This is why we use other test scores, the brain map, and parent or individual client reports and teacher reports to bring together all of our data to make a diagnosis. When analyzing the frequency of error types, interpretation is made by comparing the observed total number of errors for each error type with cutoff values that were determined by a frequency analysis of errors made by the entire normative sample. The rationale used to determine cutoff values is fairly straightforward. Traditionally, diagnostic tests used in an educational settings consider performance in the lowest quartile, 25th percentile and below, to be indicative of the need for remediation. Psychological tests often regard scores at or beyond the extreme 5th percentile as an indication of pathology. For the TVMS-3, interpretation is as follows. Scores at or above the 26th percentile should be interpreted as showing no cause for concern. Scores between the 25th and 11th percentile should be interpreted as showing moderate cause for concern, and scores below the 10th percentile should be interpreted as indicating the person should be referred to an occupational therapist or neurologist for further evaluation. In our case, since we're doing neurotherapy, we would know that these individuals would likely need neurofeedback protocols targeting the motor strip. Of course, we always take what the client or parent has to say into account. If one certain type of error is remarkable, parents and teachers can work on that particular skill at home in addition to the neurofeedback we provide in clinic. If the client or child is also receiving occupational therapy, it would be important to share the results with them as well. So that was an overview of the TVMS, obviously very brief. I will let you use the manual to learn how. And again, make sure that your license qualifications match what each test demands of you. I just wanted to show you some other visual motor tests. The Bender-Gestalt test of visual motor perception, the Ray complex figure test and recognition trial. And I'm not even going to try and say that last one. That is another test of motor proficiency. All of these are very fun. And if there is one that is more detailed than the TVMS because you're an occupational therapist, or it's of particular interest to you because you're studying a particular patient population, then by all means, use the test that works best for you. Thanks so much.